Rare is not never, and that is the mantra for Jane here at the 45th annual UCLA, let's see.
Urology course.
Well, actually the UCLA, State of the Art, that's what it's called. UCLA State of the Art Urology course.
Exactly.
Mind freeze here.
Yes, it's early.
I'm here at the exhibitors area, and Jane is selling a new-ish product. Actually, most urologists know about this product, Thiola, and is used for treatment of cystine stones, a genetic disorder predisposing a lot of people with kidney stones, usually diagnosed early on. 1 to 2% of adults have this type of a stone, and I think around 8% of kids tend to diagnose these early because these tend to be big stones, and hopefully we can diagnose them early. And what's interesting about the stones is that it is treatable with oral, one of the rare stones that is treatable with oral therapy. So something new has come up, and Jane is representing the company that sells this drug. Why don't you tell us a little bit more about the new Thiola EC?
Awesome. Thank you for the opportunity to talk to you about the new drug that was FDA approved last summer. So in July of 2019, the FDA approved a new formula, or an improved formula, we should say, of Thiola.
So what was the problem with the old formulation?
That the patients had to take a lot of pills per day. It is still a TID, or 3 times a day drug, based on the half-life of the drug, but it was also not, patients couldn't take it with food. So to tell someone to take it 3 times a day and then say, oh, you can't take it with, say, your midday meal was problematic.
Just to be clear, how many pills were patients having to take 3 times a day?
They were having to take up to 20 to 30 pills in total. So break that down.
Yeah, that's going to be really helpful with compliance. Yeah, right.
Really helpful with compliance. So now with the new formulation with 300 milligram tabs, someone who is taking, say, 2,100 milligrams a day of the drug to be stone-free and reduce their stones to a point where they don't need the wonderful procedures that you guys do, or not so wonderful procedures, they can be taking 6 or 7 pills a day, which is a huge difference, obviously, in compliance. And they can take them at the time of the day that's best for them. So we say usually in the morning when they first get up, midday with their meal, and then at bedtime for the best effect. And it is now an enteric-coated product, so it is delayed release. So we don't have data on whether that will improve the side effect profile, but we will see as patients go forward if that helps in terms of some of the GI discomfort they face in early treatment.
Now, all of my savvy urology Facebook group people are going to ask, what about insurance coverage, and is there any patient assistance with this newer drug?
That is absolutely the case. First off, patients who have commercial insurance have no copay, 0 copay for anyone who's commercially insured, HMO or PPO. For government payers, if they're Medicare patients, which is a small percentage given the age of these patients, there's patient assistance for those people if they've got co-insurance as well. So it's a no patient left behind model, and if they qualify for free drug if they're uninsured, there's that option as well. We really try to take away all the barriers to treatment, because we understand that if you write this prescription as a urologist, you want to see the end result come through and the patient actually get the drug. So that is our mission as a company.
Well, that is great. I'm sure there's a website. Would you mind sharing with us?
Absolutely. It's thiolaec.com. There's also thiolahcp.com. And the other cool thing that I want urologists to understand is that there's a dosing calculator. So there's a real equation between the dose of Thiola to control each particular patient that's based on cystine output, pH, and volume of urine. So in order to save you guys from having to do that calculation, and ladies, it's online. So you can do that, you can contact me, I can get you access to help. So it's not a dart throw. There's actually an amount of drug your patient should be on to achieve the best result.
Well, that's great to know. What I'll do is also put the link in the video description.
Absolutely.
And how do I guess they can always contact the rep or their local rep through the website?
Absolutely, they can, and they can also reach out to me if they want to. It's just Jane.Pitluck, it's Pitluck at retrophin.com. Retrophin is the company. So yeah, you can reach out to us through me. I'm happy to help anybody get access, no matter where you are in the country. So.
Well, there you go. Thank you so much.
You're so welcome. Have a great meeting.
All right, if you guys have any questions, leave them in the comments below, and I will put the links in the video description. Thanks for watching. Hello, Susan. Hello, Christy. Have a good day. Bye-bye.
Bye-bye.